For my skills validation, I will be doing the Foley catheter insertion on my male client. So first of all, I'm going to go ahead and enter my client's room. I'm going to provide privacy. I'm going to perform hand hygiene. Okay. And I'm going to introduce myself. Hello, my name is Charlotte. I'll be your nurse today, and I'll be doing a Foley catheter insertion. Can I have your full name and your date of birth? Thank you. And then I'm going to just double check, make sure it matches his wristband, and it does. Mr. Jones, do you have any allergies to shellfish, iodine, or latex? No? Okay, good. So before getting started, I'm just going to double check to make sure that there is an order for him for a Foley catheter insertion. Okay, thank you. So I've already performed hand hygiene. I'm going to instruct my patient to lay down on his back. Thank you, Mr. Jones. I'm going to don clean gloves. Oops. Okay. So I'm gonna elevate the bed a little bit, about hip level, so it is in a good working position for me. I'm gonna instruct my patient, so my patient will be laying supine. I'm gonna instruct him to have his legs abducted if he can, facing out. And during this time, I'll be performing a focused assessment, making sure if he, just checking to see if he has any abdominal distension, if he has any abnormalities to the penis. If he needed any additional perineum cleansing, then I will also perform that. Okay, thank you. So Mr. Jones, prior to starting the Foley catheter insertion, I'm just gonna get my sterile field ready. Are you feeling okay? Okay. So now I have my sterile, my catheter kit. Let me see if I place the patient this way. Yes, okay. Okay, so this is my sterile catheter. It doesn't really hold up anymore. So for the catheter, it is important. Usually you'd want to start with opening the box away from you and then opening it towards you. Okay. So in my box, I have my sterile gloves. Okay. So I'm gonna go ahead and don on my clean gloves. So I've already performed hand hygiene. I'm gonna open my sterile gloves. Okay, I'm gonna take my fingers and scoop it out. I'll try not to break my sterile field. I don't have that much room. Okay, glove is on. I'm gonna just pinch this and throw it out. Okay, so now I'm gonna take my sterile field and open it up. So with the shiny part in the bottom, I'm gonna place it between my patient's legs. Okay. So now I'm gonna go ahead and take the fenestrated sterile cover, and this is gonna be placed on my patient. Okay. So my patient will be covered, his upper body will be covered, and I'll be only exposing the area that I'm going to be working with. So that way it's there's still some privacy provided for the patient. So I'm just going to set up my equipment. So I have these swabs here, the sanitizing swabs. I think usually they're betadine, but this one is just for practice. So I'll have my swabs ready. So this is all sterile. And then I'm gonna open my lubricant, pour it here. Great, okay. So I'm going to take my syringe. So this syringe I will place on the catheter. There's a second lumen here. my bag is kind of fallen apart. So I'll place this here. So this is what I will be injecting for the balloon to inflate. I think according to the bag, it was 5 mLs of water to be pushed in for the balloon inflation. Okay. So the important thing with a Foley catheter is to make sure the patient is relaxed. So if the patient is tense, it may be hard to insert the catheter. For males, usually it's a straight cath, but if they have an enlarged prostate, it's recommended maybe that they use a coude tip. So prior to getting started, I'm going to perform, I'm going to sanitize the area. So Mr. Jones, I'm going to go ahead and just clean the area with a swab. I'm going to take my hand and hold on to the penis. And I'm going to take one of the swabs, and at the tip, I'll do a circular motion, toss it out. Again in a circular motion, toss it out. And then lastly, circular motion, toss it out. So this hand remains sterile. Okay, so I can move this a little bit here. Oops, okay, I can move this a little bit here. Okay, Mr. Jones, go ahead and take a few deep breaths. I want to ensure my client is relaxed. Take a couple deep breaths. I'm going to take my catheter, my tube, and covering it with the lubricant. Okay, Mr. Jones, take a deep breath in. So as I'm inserting, I'm going in a twisted motion and inserting it. Okay, so how do I know it's placed properly? Well, I should see a urine return flowing back. And once that's placed, sometimes I can probably put it in maybe another inch, but once there's a urine return, that should ensure that it's in the proper place. So once that's established, I can go ahead and inflate my balloon, 5 mLs. Okay. So at this point, I don't need to remain sterile. I can break my sterile field, and I'm going to take my catheter bag. It's kind of hard because it's flimsy, but usually that's secured in there because of the balloon. And I'm going to take this bag and I'm going to hang it down on his bedside.